last year, a colleague at another institution asked if anyone of the pharmacists that were sitting at the table had come across a patient having low vitamin C levels or having scurvy after transplant, and if that impacted the patient's care. And I said, that actually happens quite a bit at our hospital. When we look, we find that they do have low vitamin C levels. So I spoke with our dietitian, and we went back through our patient charts for about 7 years and looked at any patient who had received had a vitamin C level that was taken at transplant or in like the 100 days after transplant. And we found that there was a pretty high number of patients that were either at risk for vitamin C deficiency or actually were vitamin C deficient. We went through almost 400 charts, and about 30 patients that actually had a vitamin C level we could assess. So, and of those, 58% had a low vitamin C level. So they either were vitamin C deficient or at risk to be vitamin C deficient at some point during the transplant process. We did a little bit further investigation to see if the vitamin C level could correlate with any factors associated with transplant. These were indication for transplant, whether they were a malignant or non-malignant indication, prior chemotherapy, the donor source or the donor type, and then gender. None of those factors had an association with the level. But what did have an association with the vitamin C levels was the kind of nutrition that they were on prior to transplant. Patients who were on enteral feeds leading up to transplant did very well. Their vitamin C levels were in range. But the patients that were actually on a regular diet were the patients that had low vitamin C levels. So that ended up being 15 out of the 19 patients. So 3 of the patients qualified for malnutrition, and all 3 of them also were vitamin C deficient. Other things we looked at were like transplant-related risk factors or post-transplant was infection, veno-occlusive disease, and acute graft-versus-host disease. And although there weren't any statistically significant associations with the vitamin C levels, we did find that the incidence of having an infection was higher in the patients who had low vitamin C levels. So we recognize at this point, the patients we looked at were patients that we purposely were worried that they had a low vitamin C level, and that caused the team to investigate. So we've changed our practice for the time that we're now getting baseline vitamin C levels on each of our patients to see in a non-biased population what are their levels at the time that they come for transplant, at 2 weeks, 4 weeks, and 60 days after transplant. And we do, in the 20 patients that we've been able to follow since we made our change, we do see a very large dip in their vitamin C levels over this time.